Hi, my name is Dagan Cloutier, physician assistant, and I'd like to demonstrate how I administer a viscosupplementation injection. So as you can see, I have the patient's knee flexed at 90 degrees on the side of the table. And the first thing I do actually is go ahead and see if the patient has a joint effusion as I extend the knee. So no joint effusion. And next I'll palpate the inferior pole of the patella. And what I do is I move over the lateral joint line and I feel the soft spot, and that's where I want to go in, right there. So I'll make a mark with a needle cap where I'm going to inject to give myself a little target for the injection. So next I'll wipe the skin off to sterilize the skin with 2 alcohol wipes. And I'll use ethyl chloride to dull the pinch of the needle. I'll usually use it for 5 seconds or so. So then I'll take the needle. I use a 22 gauge needle, and I start with 3 cc's of lidocaine. And as I'm injecting, I give a little quick shot there. And then I inject slowly as I'm going into the joint line, aiming towards the lateral femoral notch. And you can see me injecting really slow, advancing slowly. And I'm advancing with the bevel down. I'm injecting lidocaine at the same time. And I'm looking for loss of resistance. So I keep entering. And boom, right there I feel a loss of resistance. So that confirms I'm in the joint. If I didn't have that loss of resistance, I could also aim towards the lateral femoral condyle and with the bevel down, and just tap the femoral condyle, and that once you come in contact with lateral femoral condyle, you know you're intra-articular as well. And as you can see, I uncap the lidocaine and I recap it with the viscosupplement and inject the viscosupplement slowly. So that's how I administer a viscosupplement knee injection. Thank you.